Hey everyone! Welcome back to our channel. Today, we're exploring the critical issue of lead poisoning in children, which has historically been mitigated through bans on lead in paint, gasoline, and pipes. While these measures have significantly reduced lead poisoning, new threats have emerged. Recent research highlights that more children are now exposed to elevated lead levels through food and other everyday household items. Lead found in baby food and earthenware cooking items poses significant risks. Despite regulatory efforts, hundreds of cases of lead exposure have been detected in the U.S., emphasizing the need for vigilance and broader measures to protect vulnerable children. We'll dive into the sources of this exposure, the impact on health, and what parents can do to safeguard their families. Bans on lead in paint, gasoline, and pipes have dramatically reduced lead poisoning that causes severe developmental problems in children. But another threat looms: more children have elevated lead levels from food and other everyday household items. New research has found that lead in baby food and earthenware cooking items are risks for families. We have to begin to think outside the box, said Melanie Napier, a public health epidemiologist with the North Carolina Department of Health and Human Services, which investigated toddlers who had eaten cinnamon applesauce tainted with lead. State and federal officials found hundreds of cases across the U.S. Napier said parents should be careful. It's still important to get your kids tested even if you don't think your child has had lead exposure. Children under 6 are especially at risk of lead poisoning, partly because they put their toys, hands, or other items in their mouths. They're also at risk because their bodies absorb lead, a neurotoxin that occurs naturally on Earth, more than adults' bodies. Children with iron deficiencies, which are more common in babies born prematurely or with low birth weight, absorb lead at even greater rates. Lead in any amount can cause myriad health problems for children, whether they breathe it in or ingest it. Very high lead levels can cause seizures, coma, and death. Low levels can cause behavioral problems, loss of IQ and attention deficit disorders, as well as stunted growth and impaired hearing or speech. Regulatory lead restrictions have resulted in declines in the percentage of children 5 and younger with elevated lead levels in their blood, from more than 25% of children in 1988 to less than 2% in 2014. But the bans probably do not address the exposure of all children at risk, experts contend. About 500,000 children still have levels above the federal threshold. Children enrolled in Medicaid have the cost of blood tests to detect lead covered. Many private insurers also pay for the same type of testing, typically with a finger or heel prick. Other risk factors include where children live, a consideration for families exposed to contaminated water from pipes in Flint, Michigan, or the age of their family's home. The U.S. banned lead paint in 1978. Certain communities are at greater risk of lead exposure, including children of color, families living below the poverty line, immigrants and refugees, and people in older housing, according to the Centers for Disease Control and Prevention. But Dr. Paul Allwood, the CDC's chief of lead poisoning prevention and surveillance, said there is no stereotypical child of lead poisoning. Hannah Hayes, chief of toxicology at Nationwide Children's Hospital and medical director at Central Ohio Poison Center, said there's another likely culprit that isn't included in current regulations. Some of those laws to detect lead poisoning in children might miss children who are exposed through food sources, she told. The 2023 lead exposure identified by Napier in North Carolina in baby food showed certain products can affect any family. One concern in detecting lead exposure is children sometimes don't show signs early on. This was the case for 4 toddlers identified by Napier and North Carolina officials as having eaten Wanabana cinnamon applesauce, according to a recent federal report. State and federal investigators found 500 cases across the U.S. of children who had eaten the snack and had elevated lead levels. The company voluntarily recalled the product. Regulators found the manufacturer used Ecuadorian cinnamon tainted with lead chromate, a metal often used to brighten products. The health effects of Wanabana's food on hundreds of children are still unknown. Officials said they will need to track families to understand their development. In this case, I think manufacturers were not taking the issue of lead seriously, or the issue of the potential for lead to be deliberately added to their products, said Conrad Schwanier, acting deputy director of regulatory affairs for the Food and Drug Administration's Food Safety and Applied Nutrition Center. The FDA has made an effort to inform the food industry about the kind of lead contamination seen in the Wanabana case, he said. That includes ramping up inspections and testing products as they arrive in the U.S., before they enter the market. International manufacturers wishing to export products to the US must meet the same standards as domestic items, Chouanier said. The state of lead exposure reflects a globalized economy. About a third of children globally, or 800 million children, have blood lead levels at or above the threshold that requires intervention. US products, of course, are imported from across the globe. A recent study based in 4 urban American areas found everyday consumer products were a significant factor in lead exposure for children. Researchers from the nonprofit Pure Earth and public health officials in California, Oregon, Washington State, and New York City reviewed 2,000 cases of lead poisoning. They found everyday products such as cookware and spices accounted for up to 38% of lead poisonings, though figures varied. Many of these products were found in immigrant or refugee communities. They included ceramics, common in Mexican or Afghan households, and health remedies from China. There's a groundswell really just beginning to try and fix this problem because of the cost that it creates on global economies, Richard Fuller, president of Pure Earth and the study's senior author. He said such widespread lead exposure threatens children's health and their likelihood of having a good education. That's bad for everybody, he said. Hayes, the Ohio toxicologist, said parents should talk with their child's doctor about lead screening and testing. Parents can stay up to date on common sources of lead exposure as they become identified. They may include spices, candies, and other foods. It's best to avoid foods purchased abroad from unregulated sources, Hayes said. But the Wanabana cases show that foods typically regulated domestically can also be tainted. That reinforces the need for communities to stay up to date on health announcements about outbreaks, Hayes said. Parents can also get their home and water exposure checked by a licensed lead inspector. As we've seen, the threat of lead poisoning extends beyond the well-known sources of paint and gasoline to everyday items like food and cookware. It's crucial for parents to stay informed and proactive in protecting their children from this hidden danger. Regular lead testing, avoiding unregulated food products, and being aware of health advisories are essential steps in safeguarding your family's health. Let's work together to spread awareness and ensure a safer environment for all children. Thanks for watching, and don't forget to like, comment, and subscribe for more important health updates and tips. Stay safe and take care.